So we're going to talk about the benefits, of course, increased blood flow. So one of the things that people don't realize, and I've found that even doctors, nurses don't realize this, that there is great chunks of your body that have no blood supply, meaning no artery bringing blood in, no veins bringing blood out. Can anyone tell me the part of your spine that has no blood supply? Wild guess. No. In between each vertebrae is what? The cartilaginous discs. So the discs themselves have no blood supply. So the discs, now the discs are living tissue. So how do the discs get blood in them? Movement. We move. That's how we get blood in. So we're pushing blood in, and at the same time we're pumping the wastes out. Literally, to keep those discs healthy for life, you have to move your body for life. So increased blood flow, and that is true of many parts of your body that either are that don't have a direct blood supply or have a very minor blood supply. Movement gets blood in there, gets all the nutrients in there, gets oxygen in there, and movement gets all the wastes and all the toxic substances out, like lactic acid. So all cells have wastes, and we need to get those wastes out and get them out of our body. And so movement is a big part of that. Increased proprioception. So this is a fancy term meaning your body's perception of movement. Anyone ever wonder why we have vibration plates here? It's to increase proprioception. You guys should know this. So increased proprioception happens when our joints, which all of our joints, our tendons, our muscles, our ligaments, have little sensors in there, little sensing cells. And those cells are specific for sensing movement. So when I stretch a ligament, the ligament there in my elbow is now telling my brain it's being stretched, which tells me that my elbow or my arm is being extended. I don't have to see it. My brain already knows it. So even if you take someone and you blindfold them and you say, is your arm bent or extended? They go, it's extended. Because those sensors have told my brain. In essence, that's proprioception. And proprioception is things like vibration, is movement, is blood flow. So there's a lot of factors there. The sensation of pain is called nociception. Nociception and proprioception are opposites within the brain. So when your proprioception is high, if your brain is perceiving movement, your brain's perception of nociception goes way down. In other words, movement trumps pain. So when you move, your body's not sensing pain, which is another reason why we use the vibration plates. The other thing so nociception is pain, but it's also sort of negative in the body. So stress would handle that, anxiety handles that, sort of irritation to different tissues or cells handles that. So when we decrease those things, we actually improve our reaction to stress, which means our stress hormones decrease. In other words, movement decreases stress on your body. So you ever notice, bless you ever notice that when people are stressed out and they exercise, they do so much better? It's because the movement and the sensation of movement is trumping the stress and is decreasing your stress hormone and is allowing your positive hormones, your endorphins and so forth, to rise, which means your body can handle things better. Now, here's one thing that we're going to differentiate, because we're going to get into stretches and movements and so forth. But one thing that people sometimes think is that exercise is movement. Bless you. Which is not true. Exercise is a part of movement, but if I'm exercising, for example, I'm walking, am I moving every joint through its full range of motion? No. So if that's all I did, I just walk. Am I actually moving my full body through its full range of motion? No. And so even people that are very athletic, people that work out, they may not be moving their body through a full range of motion. That's why we talk about two angles. One is movement and stretching and getting those joints through the full range, whatever that means to you. And the second is doing aerobic and resistance training to help aerobically and help build muscle, right? So those are two very different things in a lot of ways. Interesting is some of the most ancient techniques of exercise, meaning yoga, Pilates, these are all based on sort of ancient things. They're all based on trying to combine those two things. So you're trying to combine strength and resistance training with some aerobic training with moving your body through its full range of motion. Isn't that interesting that now it's making a recovery? People think, oh, this yoga stuff's a new thing. It's like, no, they've been doing that for, you know, and that would encompass things like Qigong and Tai Chi and ancient sort of techniques of martial arts that move your body through a full range of motion while at the same time work on the strength and that kind of stuff. So very cool with that. Range of motion, of course, I've talked this a little bit already, but range of motion is different for every person. So I have one patient who's in his 60s who can still do the splits. And, you know, I say, man, that is awesome that you can still do the splits. But almost all kids can do amazing things with their, maybe not splits, but they can certainly put a foot in their mouth and stuff that adults generally can't do. So the question is, joints can be different for different people depending on how you've exercised. That's why a sumo wrestler looks different than a long distance runner, because they're training in different ways, they're using their bodies in different ways, and their bodies adapt over time. So when we talk about range of motion, we don't mean you have to do the splits. What we mean is you move your joint through its full range of motion right now. So for example, I'm going to show you, and we're going to go through some of these things, because I want, if you did this every single day, moved every single joint that you have through its full range of motion at least once a day, every day for the rest of your life, you will notice better function, less pain, less arthritis, better mood, all these things. So I'm going to show you the upper body. So this is the hand through the wrist to the elbow, whatever. And we're just going to, you can do it with me. We're just going to try and move our hand through its full range of motion, wrist through its full range of motion, elbow through its full range of motion, shoulder through its full range of motion. Shoulder is a difficult one because it's got so many ranges. But in general, the easiest way to do it is you're going to stretch out your hand as much as you can, and then you're going to curl your fingers into a fist, and then you're going to come right back out and stretch it back out. And essentially what I've done in that tiny little bit of time is I've moved every joint in my hand and just in my hand rather, through its full range of motion. And I can do that several times, and you feel the blood start to flow and so forth. The wrist goes in two directions, so it's back and forth, and it's side to side. Back and forth, side to side. Elbow's a one-dimensional thing. I'm going to show you two ways to move it. It's still one-dimensional, but it's full flexion, full extension, full flexion, full extension. And then you're going to turn it over, and it's full flexion, full extension, So this is two ways to get it. You're actually using different muscles. It's not the joint that's moving differently. It's just muscles that are doing differently. So the shoulder's a little bit different. And so the shoulder I like to do with a stick or a broomstick or a highly expensive exercise tool, as I say. But with the shoulder, you can go from, this would be considered neutral, and you go all the way forward and then all the way backwards. And that's there. And then you're going to go side, so you're going to go all the way to the side as far as you can go, and then all the way back across the body to the other side as far as it'll go. And of course you can do these, you know, both at the same time. So just to recap, I'm going forward and back and coming back to neutral. Now bear in mind that we're going to go over this mantra many times. Forward and back, side to side, and then I'm going to rotate it all the way and rotate it all the way. And in essence, although the shoulder can be moved in many different directions, I've now moved that shoulder through pretty much its full range of motion. Remember that mantra: forward, back, side, side, turn, turn. I like your dance. Your body, and I don't mean to gross anyone out here, but your body has little cells that go around and they lay down little strands of collagen. That's what they do. That's what they do for a living. That's what they're paid for, and they do it 24/7. So they are circulating through your body right now, laying down little strands like little spider webs. Don't think of them as spiders, that's way gross. But if you think of them just as they're laying down these little collagens. Now those collagen fibers are the basis of scar tissue. When we get an injury, those little cells are attracted to that injured area and they start laying down collagen fiber like you wouldn't believe. And that is how scars are formed. So it's laying down little collagen and then it's pulling the two ends together, which closes the wound, helps healing, helps knit that area. So this stuff happens all the time in your body. You don't, bless you, you don't have to learn how to do this. This happens innately. So that's happening throughout your body. If you don't move your joints, if you're sedentary and you're just sitting all the time, and these collagen fibers are getting laid down randomly all over your body, what happens?
You get stuck to the pirate ship.
You get stuck. You get stuck in position. That's why when people come to us for the first time in chiropractic and we adjust them and we hear this big old crack and things start moving, we're actually breaking up those collagen fibers. We're dusting out the cobwebs, literally, in your body. Now, that creates inflammation, which is why sometimes people are sore right after the first few adjustments. But once you break those things up and you allow movement, now it's onward and upward. What happens when you move your body through? And so instead of being sedentary, you're up, you're moving, you're bending, you're twisting, you're whatever. What happens to those collagen fibers? You break them naturally, which is what it should be naturally. Now with a scar, that's why, or with an injured area, that's why they immobilize it to allow those collagen fibers to get in there. In fact, if you look at a scar is a collection of all these collagen fibers in all different directions, 360 degrees. And they're all pushing the wound closed in all different degrees. But once the wound has healed and the trauma is now in that healing phase, we want to break up all the collagen fibers that are not aligned with that joint or that muscle or that tissue. That's what physical therapy essentially does. That's what cross-friction massage does. Let's break everything up that's not serving that tissue well, and if it's all lined, that scar will actually form stronger than the original tissue in many cases. What happens if it's not correctly healed like that? You get a kind of a big bump, almost like a big mass in there, and that's where you can see it pretty easily when you see a scar that's all gnarly and big and whatever. That was never, broken up. And so after a while, after the collagen fibers are still laid, then it becomes very difficult to do that. But movement through recovery, vital if you want good healing. That's why a lot of physical therapists, and I know Trish and I are on the same page with this, when people say, I got to wear this cast on my leg or whatever for 6 months, we're like, let's cut that thing off. Let's get you moving. It doesn't have to be like extreme exercise, but we got to get you moving because movement is life. We need the blood flow. We need to break up the collagen fibers. We need to get the oxygen in there, all that stuff. That makes sense? So movement is so much more than life. Now, the reason why we talk about this before I show you this very stretches is that I want it to be more than just, he showed me how to stretch my back. I want it to be like, no, he gave me the bigger picture of life, which is I got to move for the rest of my life. I got to do this kind of stuff, learn how to move and how to get that vitality flowing and the power that God gave us throughout our whole body. That makes sense? You can see I'm a little passionate about it. So decreased degeneration. So degeneration, the vast majority of degeneration, although doctors love to call it arthritis, is not arthritis. It would be correctly called degeneration. It's where the joints are not functioning normally. They're grinding and they wear, and you see the wearing of the bone, you see calcium formation, all that kind of stuff. You want to decrease that, move your body through its full range of motion. Super easy. Improved nerve function. So this is primarily with the spine, but if you have better movement, better alignment in the spine, you have less pressure on your nervous system, which means your brain can talk better with your organs, cells, and tissues, which means better organ, cell, and tissue function, which means better you. That is literally the power that God gave you being fully expressed. You keep good care of this, everything flows better. Simple. Okay, so you ready to go through the back stuff? Yes would be the right answer. So we're going to go back to our mantra. Forward, back, side, side, turn, turn. And so we're going to treat our spine in 3 sections. We got our neck, or cervical spine. We got our mid-back, thoracic spine. And we got our lower back, lumbar spine. We do them in 3 separate sections to kind of really focus on moving every joint. Anyone know how many vertebrae we have?
36.
Close, but less. Maybe you have 36, I don't know. No, not 36. How many, let me ask you this. How many cervical vertebrae do we have? 7. How many cervical vertebrae does a giraffe have? 7, correct. They're just way bigger. Most animals have 24 vertebrae, 24 working vertebrae. There's some variability there, but most have 24 vertebrae. We have 24 vertebrae. Each vertebrae has 6 joints above and below. So we're moving all 6 times 24 through its full range of motion. So we start with the neck, we move to the thoracic spine, we move to the lumbar spine. As you get more confident and more comfortable with this, then you can combine all of them. So I'm going to show it first, or you want to show it, or I'll show it. And then I'm going to go, then we're all going to get up and we're going to do this. So forward, back, side, side, turn, turn. Can anyone tell me how many motions the spine has? Now I just told you some. Forward, back, flexion, extension, lateral flexion, rotation, rotation, and there's 2 more. Anyone know what they are? Longer, shorter. Extension, compression. How do we extend? Well, you go on either you get someone to grab your head and pull, or you lie in an inversion table, right? Compression you don't have to worry about because we're all compressed all the time. Gravity does that for us. So we can't really worry about the last 2, so we go with the forward, back, side, side, turn, turn. So for the cervical spine, this is the only one that varies a lot because the top 3 vertebrae kind of move separately. So in other words, I can flex forward, but I still got a lot of flexion that I could get out of it with those top 3 vertebrae. So the simple way to do this is to tuck your chin and then roll forward. And then you come back to neutral. And then for the extension, so that's forward, back would be lift your chin to get that extension in the top 3 vertebrae, and then bring it back. So forward, back, side. So always start from neutral. If you start from neutral, you'll never miss any. Some people start from flexion, and then they're missing parts of the joints. So you want to start from neutral. So side to side. Back to neutral, rotate or turn, rotate. It doesn't matter if you have restriction. You just go as far as your body will let you. You don't worry about trying to increase that. Just go as far as it'll let you go and come back. You don't have to hold anything. Forward, back, side, side, turn, turn. For the thoracic spine, the easiest way to explain this is to pretend that I have a pole inserted right through the middle of my shoulders. So this pole kind of goes right through the middle of my shoulders. And so when I go forward, I'm bringing that pole as far forward by flexing my spine, almost like the angry cat, you know, in the thoracic spine. Then I come back to neutral. And then I'm going to try and bring that pole as far back by extending that thoracic spine. And then from there, I'm going to tilt the shoulders. Notice that I'm not tilting my neck. The neck is separate. I'm just tilting the shoulders, and then turning the shoulders and turning the shoulders without moving my belt buckle. So this you can easily do sitting because your pelvis is held when you're sitting. When we do the lumbar spine, you have to stand. There's no way to do that in a chair. So forward, back, side, side, turn, turn. For the lumbar spine, what I recommend is that you bend your knees when you do this. That way you're not stretching out your quads or your hamstring or your glutes or any of that kind of stuff. And you're just going to try and roll this spine forward and then roll your spine backwards. Come back to neutral. Now I'm tilting my belt. I'm trying to tilt by leaning. Notice that I'm not trying to do this with straight legs. I'm bending my legs and getting in there, bending my legs and getting in there, lateral side to side. And now I'm allowed to turn my belt buckle. So now I can really turn my belt buckle, but you'll notice I'm not moving my feet. So I'm turning through there. So if I want to combine these, I would tuck and roll forward, shoulders forward, back forward. Come back to neutral. Forward, forward, forward. Lift my chin and go back, shoulders back, lumbar back. Come back to neutral. Side, 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 side. I'm obviously speeding this up to go through it. Turn, 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 turn. I've just moved every joint I have through my entire spine through its full range of motion. What you'll notice, because we're going to get up and we're going to do this together, what you'll notice is you automatically feel blood flow and you feel more proprioception than anywhere else in your body. Turns out, obviously, the way we were designed, it must be for this because we have more proprioceptors, more of those receptive cells in our spine than anywhere else in our body. How cool is that? You want to bombard your brain with proprioception, you move your spine through its full range of motion. Sound cool? My favorite exercise tool, which hangs around in my house at all times, is this super expensive tool. You can buy the Dr. Ross version for $150, or you can go to any store and buy it for about 10. So this is a great tool for just stretching and movement. When you, first of all, if it's around your house, it kind of, you visually see it and you say, I'm going to get up and stretch, or I'm going to move, you know. So that's the first thing. The second thing is it allows you to move joints. For example, I can push with this hand and stretch my arm out in all sorts of different ways when one arm is helping the other. So you don't necessarily have to have a routine. You'll feel where it stretches and how, you know, like for example, I can push on this side and stretch my body further than I would normally be able to do. The other thing that's great with this is we're going to talk about that flexion exercise, which for anyone with back pain, with lower back pain, this is a must, and it's so easy to do. I know Ashton's going to go over some of the yoga things and that kind of stuff, but for this, it allows you to use the bar to pull. So I'm pulling up, but my legs are here, so I'm just pulling, and I'm allowed much more movement in that lower back. So I can do that in a chair, like I just did, but even better would be lying down or sitting down. I can put this underneath and stretch that way. And I'm now able to use this as leverage to stretch me that much further. If I want, I can now do it behind my feet and stretch even more. Now I'm pulling on this bar. And if I want to even get more out of it, I can start to extend my legs and really stretch it. So as a way of stretching out the lower back, this bar works beautifully, cheap and effective. Make sense?
Hi, my name is Ashton Reynolds, and I'm the yoga instructor here at Lighthouse Wellness Center, and I'm going to be showing you some stretches and exercises to move your spine in every direction. So starting at the top and moving down, we'll go through the cervical spine, which is your neck, and the spine will move in multiple directions. So we'll start off dropping the chin in towards the chest and then lowering forehead down towards the earth. Stretching the back of the neck here. And then inhaling it up, pressing up through the jaw, dropping the head back, getting that backwards flexion. And then coming through, turning and gazing over to the left and moving over through the right. Back through center and getting into the rotation. So lowering chin to chest and inhaling left ear to left shoulder. Exhale through center and inhale right ear to right shoulder. Exhale through center. Inhale to lift the head and moving to the thoracic spine. So drawing shoulders towards the pelvis. You'll do shoulders down, drawing belly button back towards the spine, hands grip on the knees, and then inhale, pulling the chest up towards the sky. You can do this many times. In yoga, we call this cat-cow. And we're getting that forward and backwards rotation of the spine. And then moving through the side-to-side motion. So we want to make sure we keep our belt buckle straight. The belt buckle is not moving here. And we're drawing shoulder down towards the hip on each side. So we're just mini movements here, side to side. And then you can do that as well, rotating. So belly button stays the same. And you gaze over the shoulder, drawing your shoulders with you. So you can imagine there is a bar going through the shoulders. And that's the only area that you're moving. The hips are not moving, your knees are not moving. From here, moving into the lumbar spine, the low spine, the forward and back will be very similar to the cat-cow we did earlier, but it will be more exaggerated, more movement. So inhaling up, you're gonna get really big and bendy, and then down, belly button to spine, but you're gonna really, really pull back till you feel a stretch in your low spine. You can do that again as many times as you would like. And then now we're going to be moving through the belly button area. So side to side, drawing shoulder to hip. So if you're in a chair, you can use your hands as a guide to get nice and low. If that's not a movement that you're able to do in your body, you can use the armrests. So coming down side to side. Make sure you feel that stretch right there on the top of your hip crest. Getting nice and big in that C shape. And then the twisting, the rotation, we want to move the belt buckle here. So using your hands is a good idea in this posture. So your right hand will go to left knee, left hand will go behind you. We're moving through the low spine. Inhales, lengthen the spine, exhales can deepen it. And gently unwind, left hand to right knee, right hand behind you, nice and tall. And then twisting to your right. So we're moving through this belly button, the pelvic girdle here. And slowly coming back. A nice stretch to kind of get in that lumbar spine would be getting nice and tall. Belly button moves in, move forward, hinging forward, and then you can relax and lay your chest onto your knees and let your head drop down. That's a really good low back stretch. So that are all of the movements that you can do through the spine, and it should take you about 5 minutes in your daily practice. So,
not calling anyone out, but if you're not doing this, start doing it. That's the first thing. Don't worry if you're not doing it perfectly right. Don't wait for the YouTube video to show up. Don't try and get the perfect equipment. Just start doing it. Movement is huge. You may be doing it wrong, but that's okay. Figure it out as you go. Ask for help. Ashton is awesome. Dr. Trish is awesome. Just about everyone in this office knows a lot of stuff, so ask if you want help, and we'll definitely give it to you. Which would include, if you want pictures or something like that, we can download them off the internet and get them for you. So, so the first thing is start, do it. The second thing is, if you're not aerobically exercising, and in general, it's 20 minutes, but that doesn't mean 20 minutes at a time. You can do two 10-minute sessions. They've showed statistically that doesn't make any negative. So do it for 20 minutes a day, at least 4 days a week. And that'll make a huge difference with this movement. How often do you move every day? Take your body through its full range of motion. How many times a day? At least once. Yeah, at least once. And you'll know that you can actually move your spine through its full range of motion in about 30 seconds. So you could do it several times a day. It's not that difficult as long as you're doing it. One thing that I do recommend is that you find a time to guarantee this gets done. The best times, so what time do you brush your teeth? 9 o'clock, okay. So I'm gathering that you probably brush your teeth at 9 o'clock or thereabouts every day, right? You don't go without brushing your teeth. You probably are like me, where if you went to bed without brushing your teeth, you'd be like, oh my God.
Get up and go brush.
Right. So do it, it's 30 seconds. How long does brushing take? Probably more than 30 seconds. So do it, I once said, do it while you have the toothbrush in your mouth, which I used to do, and then a dental hygienist scolded me and said, well, what if you fall and hurt your teeth and stuff like that? And I said, okay, so now I do them separately. If you're a morning person, do it in the morning. If you're an evening person, do it in the evening. Most of you, I'm sure, brush your teeth twice a day. So do it at the same time, or figure out a time that you do it. Or if you work out, and every time you work out, the very first thing you do is you move your spine through its full range of motion. It's 30 seconds. But you got to make it routine. How many days in a row does something become habit? 30 days. 30 days. So you do it every day for 30 days, it becomes habit. Then you kind of just get into the routine. It feels weird if you don't do it. Make sense? Last thing is, if you have problems, so we always get it like, well, I tried to do this movement, but it hurts when I do it, or I can't do this, or I can't do that. You got to ask. If you have problems, ask for help. That's what we're here for. That's why we do what we do, is we help people. That's how we're called to serve. So ask for help. We'd be happy to help you. Attend a class. If you've never done one, it's phenomenal. Ashton is a phenomenal teacher. And so attend a class. You won't regret that you did. Or if you have some other thing, like if they're offering something at your gym or whatever it is, go to that. Attend it. Make that action step.